everyone, it's Veronica, PA here at Laser Skincare Center. We have Lorraine today, and she is one of our patients who is getting the Clear and Brilliant treatments. Today we're focusing more on her pore appearance, maintaining her skin texture, her tone. She looks actually really good as far as her skin tone. So we're just gonna, keep her that way, maintain the skin, the texture, and we're working on her face today with the Clear and Brilliant, and this is the laser we're using today right here. This is the original handpiece. There are two separate handpieces that come with the Clear and Brilliant. This is the original 1440 wavelength, and the other one is Permea. So this one is going to help again maintain her pore, her texture, her tone, as well as help with her pore size. The other handpiece that we use is the Permea. That helps more so with pigmentation. Same thing, does the same as original, but works a lot with more of the pigmentation. So we're gonna start. She has been numbing already for about 30 to 60 minutes. When you come in our office, we have you numb topically. She wiped it all off. We put on these little sticky eye shields, and we can go ahead and get started. So this is the treatment level. She's done this a few times already, so what I'm gonna do is I'm actually gonna go on a setting of high, and we'll start. And so Lorraine, let me know if there is any pain. You need me at some point to stop, or just let me know if you need me to take a break, okay?
Okay.
Okay, here we go. So we go pretty slow. We wanna go ahead and hit all of the areas, and this can go over her eyebrows. It's not gonna go ahead and do any kind of hair removal. How are you feeling, Lorraine?
Fine.
Good. Any pain? How does it feel?
It feels like I'm doing fireworks, like the 4th of July, the sparklers. It's just
Coming
a little,
up, yeah.
just a little bit. It's not real painful.
Okay.
It's just a
Like prickling a
yeah.
little bit? Okay,
Yeah.
okay, perfect. Yeah, you're doing great. So I like to typically do sections of the face. I start off with the right forehead, then we do a few passes here. This is considered 2 passes when we're going over her forehead here. Then I kind of like to cross hatch this a little bit. What happens is when we do this, we're able to get really every kind of little small surface of her skin here. And so with continual passes of the Clear and Brilliant, she will start feeling a little bit more warmth and heat. Are you feeling that, or how are you feeling?
Yep, I feel warm.
More warmth, okay. So depending on her skin type, coloration, what her problematic areas are, we would do a few passes. Typically, we do about 6 to 8 passes, sometimes as much as 10 passes with the original handpiece, but we'll stick to about 6 to 8 today for her. And this is, again, more maintenance. She's done this a few times. Usually we recommend a series of 4 to 6 treatments. We're almost there. How are you doing?
Fine.
Great. And after this session, what we would recommend is do another session. Her in about 4 weeks is usually the intervals that we would pick. And she would go home after today looking a little bit red. I usually say downtime about 3 to 5 days. And great, I'm gonna have you turn this way for me. And she's gonna go home a little bit red, almost like feeling like a little bit of like not a sunburn, but almost like a windburn. But that redness will go away pretty quickly. And I usually have her moisturize post-treatment with a good type of moisturizer. We have a whole line of them here with the Sente products, Skin Better line, Elastin, any of those. We would just kind of talk to the provider about which is best for you post-treatment. How are you feeling?
Good.
Good. Still some of those fireworks.
Mm-hmm.
And how does your right forehead feel?
My right forehead?
Mm-hmm.
I don't feel anything.
Great.
Mm-hmm.
Perfect.
It doesn't linger or last.
Excellent. So as you can see, it's obviously a little bit more pink, a little bit more red, and that's typical of an immediate post-procedure. I've had patients sometimes tell me that, within 2 days the redness has gone away, but they start noticing that obviously their face feels better, it looks better, it's more bright, the texture is better. You doing okay?
Mm-hmm.
And along the hairline tends to be a little bit more spicy just because some of the numbing doesn't hit that area. So we did the forehead, and what I typically do is I put a little bit of some type of cream or moisturizer or hyaluronic acid on top of it post procedures. Sometimes we could use hydroquinone, for a patient who has pigmentation problems. We would do that right afterwards, and then ice, and she can go home. That's it.
Do I stay out of the sun?
You definitely want to stay out of the sun. This is a laser procedure, so your skin is going to be a little bit more sensitive to that. So you definitely want to avoid the sun as much as you can during the week, and wear a hat, wear sunscreen. Yeah. All right. Well, that was a little mini session just to show you guys what Clear and Brilliant's about. Got to talk to Lorraine, kind of give you a patient response and let you know what it feels like. That's it. We'll see you guys soon, hopefully.